then you will have maybe reproductive type. In the endocrine we will see the most important one. اللي هو ايش؟
هرمون.
ADH. Hormonal. Okay, the first hormone is important one. The metabolic process will ايش؟ الانسولين. Okay. Insulin affects mainly on the carbohydrate metabolism. In this blog we will see what are the metabolic processes اللي بيحصل in the carbohydrates. ايش التحليلات related with the carbohydrate. دهون شفناها related triglyceride cholesterol. بروتينات you have seen total protein albumin. Okay, والإنزيمات. طيب in the carbohydrates what are the tests we are going to do? We are going to test the carbohydrates. طيب let us see mainly what are the common carbohydrates in which we eat. Glucose. We eat glucose?
No. Starch.
We eat macromolecule starch, which contains glucose. Okay. Glucose combined together by a glycosidic bond. So we will break down this and we will get the monosaccharides, which is glucose. Type. هذا من الستارch. والglycogen, we eat a glycogen. We also break down and to get a glucose. طيب لو شربنا كوباية الحليب contains glucose and galactose. طيب so the monosaccharides which you will absorb هيكون glucose and galactose. طيب the third one is a piece of fruit. Fructose. Okay. So the monosaccharides which we will absorb هيكون ثلاثة اللي هو glucose, galactose, and fructose. Okay. When we absorb this, you'll go into the liver. Galactose and fructose they are converted into glucose. Okay. So the main sugar in which we utilize is glucose. Okay. Others can be metabolized, but they are in a very small quantity. Right? But mainly we will use the blood glucose. Okay. This glucose, when it circulates into the blood, نسميها ايش؟ glycemia. Glycemia. Glucose في الدم. أيوة. Or simply we can call what?
Blood sugar.
Okay. Blood sugar. Glycemia, blood sugar. طيب after we eat these carbohydrates هيحصل ايش؟ absorption. It will go into the liver where fructose and galactose are converted into glucose. So after each meal what will happen? نسبة الجلوكوز في الدم هيرتفع. Okay? نسبة الجلوكوز في الدم هيرتفع. This glucose will stimulate the pancreas. Yeah, which cells? Beta cells of the pancreas to produce insulin. Okay. This insulin will act on the most abundant cells in our body. اللي هو liver? لا. Brain and liver does not need insulin. Adipose tissue and muscles. Okay. Muscles and adipose tissue. And these are the most abundant cells. أكثر خلايا اللي عندنا هو adipose tissue and muscular tissue. Some people they have less adipose tissue, but those they have need this insulin. Okay. So whenever we have a meal, carbohydrates هيرتفع blood sugar to stimulate the pancreas to produce insulin. This insulin will react with the receptors of the adipose tissue and muscle. This reaction of insulin with the receptors, it will stimulate, it will activate again glucose transporter. GL. Okay. So it will open the gate. ايش اللي بيحصل؟ All glucose, high glucose which was circulating will go inside these cells. It will be shafted. Okay? So it will go inside the cell. هينزل بالنسبة للجلوكوز هتنزل. Okay? Inside the cell هيحصل more metabolic process. Glycolysis, DCA cycle, more energy production. Okay? هذه الميتابوليك process. What will happen if there is no insulin?
High blood sugar.
Insulin ما في receptor will not react with the glucose. Glucose will not go inside the cell. So what will happen? Glucose constantly will circulate in the blood. High glucose circulating in the blood.
And start
Yes.
Start the glyconeogenesis.
And it starts is what?
Glyconeogenesis.
Gluconeogenesis. هذه in the metabolic process we will talk later. So in this case what happens? High blood sugar constantly circulating in the blood. Is it normal? No. It's abnormal. So in this case we call it disease. ايش المرض هذا؟ Hyperglycemia. مرض which causes hyperglycemia is called as what? Diabetes. Okay? Diabetes. Due to what? Deficiency of insulin. Okay? So this type of diabetes we call insulin-dependent diabetes mellitus. Insulin-dependent diabetes mellitus, or GOD, juvenile onset diabetes, or type 1 diabetes. هذه كلها the same. And this usually takes place in a young person. Wherever you find a very young person, 20, age of 20, 18, 7 years, high blood sugar, diabetes, that patient type 1. Okay? Because it needs what? An insulin. Insulin-dependent diabetes. Type, okay. Juvenile. Yeah, juvenile onset diabetes. Juvenile onset.
Insulin dependent.
Insulin dependent diabetes mellitus, or we call juvenile onset diabetes. هذه diabetes سبب ايش هو؟ نقص insulin. طيب another patient they eat carbohydrates, blood sugar هيرتفع, it stimulates the pancreas, produces insulin. But this insulin will not react with the receptor, problem in the receptor. So what happens? The same thing. There will be no reaction of receptor insulin. Insulin resistant or receptor agonist. So what happens in this case? The blood sugar ما حينزل. It will be high blood sugar circulating. But the reason of high blood sugar is different from the previous one. أول كان في نقص الإنسولين. But this patient have got high insulin. So he have got the diabetes. نوع الدايابيتس هذه نسميها ايش؟ نون انسولين ديبندنت. بيشنت هذه ما يحتاج الانسولين. ليش؟ لأن الانسولين حقه البنكرياس حقه شغال. الخلل فين؟ الريسبتور. So non-insulin dependent diabetes mellitus or mature onset diabetes. That means هذه diabetes تجي واحد عمره أكثر من 40 سنة. 40 سنة 50 سنة هتجينا المرض هذا. ليش؟ لأن الريسبتور is a protein. Receptor in the membrane, they are protein. They are synthesized. So they can be reduced in number. What will happen? Let me get example. غالبا this type of diabetes اللي هو non-insulin dependent diabetes هتجي on the patients who are over 40 years. عمره كم؟ أكثر من 40 سنة. Okay. And they are usually obese. Obese means what?
Very fat.
Okay. Why they came to them to diabetes? Why it comes to them? Type. Example. When one will be fat. When one will be fat and have more adipose tissue, more muscle. He eats more. بياكل كثير. Okay. His calorie There are some hormonal effects, but usually some people they have high diet. واحد يفطر الصباح في البيت يجي في الجامعة الساعة 10 يروح على الكافيتيريا ياكل الساعة 1 غدا في العصر شوية سناكس كافيتيريا الجنب البيت في المغرب يروح على البيت بالليل متأخر يروح حفلة كبسة. So what happens? He constantly will have what? High blood sugar. Okay? High blood sugar, constantly. So this high blood sugar, he can cook. When he is young, he will stimulate the pancreas to produce what? More insulin. More insulin produces more receptor reaction. So more energy will be produced. So he can have more energy. The cells نفسها genetically الخلايا حيكون ايش؟ ماكرو سيلز. الخلايا حقه برضه enlarge حيكبر. So there he will have what? Macro cells. Plus increment of his body. Right? Because he will gain more cells. The animals tissue more cells to the muscle. The receptors they are limited. They are limited. The protein which is synthesized in this receptor, they are limited. So what happens? Whenever an insulin reacts with the receptor, هيحصل a process called down degradation. That means receptor insulin trapped together will go inside the cell. خلاص that receptor راح. So what will happen to this patient? عدد receptors
reduce.
Okay. Such a patient they have low receptors, they have macro cells. Okay. So he will have what? Diabetes. Right? This type of diabetes بنسميها ايش؟ non-insulin. This patient, how you treat him? العلاج حيكون كيف؟ First patient عندها نفس الانسولين. You will give him insulin. First patient. Okay. Insulin you will give him oral or injection يا دكتور؟
Injection.
مين قال oral? Why not oral? أيوة.
Because if you take it oral, will not go to the bloodstream directly.
Why it will not go to the blood?
Because will digest.
It will be digested. Good. Insulin is a protein. Whenever we eat a protein, what will happen? فيها كل الإنزيمات اللي موجودة في عندك اللي هو أول شيء الحمض هيدروكلوريك أسيد. بعدين في 50 days endopeptidase, exopeptidase, and enzyme trypsin, which breaks down this protein into amino acid. So the insulin protein, which you get orally, what will happen? It will be destroyed. You cannot, and it cannot be absorbed. The protein cannot be absorbed. So insulin cannot be taken orally. خليكم معايا. Insulin cannot be taken orally. Why? Because it's a protein, it will be digested. Type insulin always will be get an injection. Insulin injection. Oh, so the first diabetes, you will give him an injection of insulin according to the value. Doctors they will give units of insulin per 8 units per kilogram, حسب the weight of the patient. If he's more fat, more weight, 100 kilogram, he will get more insulin. If he's less, he will get less insulin. According to what? Units per kilogram weight. Kilogram weight of the patient. And you will get in detail how many units you will get, how you treat the patient. Okay. What about the non-insulin dependent diabetes mellitus? Patient has insulin enough. There are problem in the receptor. So what you will do? العلاج بتختلف. العلاج بتختلف. How you treat? You will ask him diet. Injection ما
Regulate his food.
Diet. You will say خفف شوية الحلويات اللي أنت بتاكل. خفف الأكل كثير so that you can reduce the quantity of glucose in your bloodstream. Less glucose receptors can be preserved. اوكي طيب دايت ما يشتغل شهر شهرين 3 شهور ما نفعت.
Like Glucofide, I think.
Glucofide. قبل الجلوكوفايد you will give him what? You will advise him to do what? Exercise. To burn more carbohydrates. ما نفعت. At that time you will give him tablets اللي هو oral hypoglycemic agent. Oral hypoglycemic agent. These tablets, they will reduce the glucose. In what way they will reduce? There are different methods, different actions. Some of them, they will stimulate the reaction of insulin receptor, so working in the peripheral tissue. Other oral hypoglycemic agents, what they will do? They will cover the intestine.
To not
So that glucose
cannot
will not be absorbed.
absorb.
ايش فين بيروح الجلوكوز اللي انت بتاكل فيها؟ هينزل. يورين؟ لا not يورين with the stool لأنه ما في absorption. اوكي؟ ما في absorption. طيب how do we follow and how we diagnose this disease, diabetes? We will diagnose by estimating what نسبة الجلوكوز في الدم. اوكي؟ نسبة الجلوكوز في الدم هذه we will divide according to chronological timing, type, or we will call what FBS. BS هو ايش؟
Blood sugar.
F fasting. Right? أول يوم في البراكتيكال we have done an animal experiment. Rat. We have seen that fasted rat and fat rat. Okay. So patient هذه if you have got high blood sugar, you want to know هل هذه high blood sugar لسه في الفاستنج ولا high blood sugar in a fat state.
Fat.
What you will do? You will get from the liver? No. You will get sample of the blood. You will ask the patient بكرة الصباح وانت صايم مدة 12 ساعة go and do the blood sugar. So we call fasting blood sugar. طيب what about in the fat? لو نبغى نعرف الفات blood sugar, what we will do?
After meat.
You will say, okay, go have your breakfast, تعال بعد ساعتين. So we will call second point blood sugar or postprandial. Postprandial ايش معناتها؟ بعد الأكل. Postprandial blood sugar. Okay, so in this case, when you do the patient, these two tests, fasting blood sugar and second point or postprandial blood sugar, you will know in his fasting state blood sugar come. In his fat state blood sugar come high. Okay. طيب انت جالس في العياده دكتور جالك واحد you doubted that you have got diabetes. What are the tests you will ask him? فت ولا فاستن؟ انت ما تعرف هو اكل ولا ما اكل.
بت
ها؟ انت بتسال متى اخر مره اكل؟ فبيقول والله شربت كوبايه شاي بس ما اكلت. It's fat. You will not say. So what you will do? At that time, بعيد من الشك you will say RBS. ايش هو RBS? Random. عشوائي. Random blood sugar. Any time of the day. Any time of the day. Blood sugar tested is called what?
Random.
Random. Okay. So these are chronological tests in which we will estimate the blood sugar. Fasting, you will know normal rate of the fasting. If someone is diabetic, his fasting will be high. If he eats, it will be active. Okay? Like these are the chronological tests. طيب بعدها you will do another test اللي هو oral glucose tolerance test or GTT, oral glucose tolerance test. What's a glucose tolerance test? It's a test in which we will do for a diabetic patient. جالك patient, he looks normal. He says I'm normal, ما عندي مشكلة. But when you test him, you find that he has got blood sugar high. غالبا postprandial بعد الأكل. So in that case, you will see هل البيشنت هذا diabetes عنده ولا ما عنده. Okay, if you have got a diabetes, هل الدايابيتس حقه dormant ولا صح؟ dormant معناتها ايش؟ نايمة. It can wake up at any time. That means he can be sick at any time. So to give him advice عشان ما يحصل الدايابيت, what you will do, the test you are going to do is called oral glucose tolerance test. You want to see how he can tolerate. That means how he can metabolize glucose in which he eats. So what you will do, you will ask him to go to the laboratory and do the oral glucose tolerance test. In the pharmacy there are a beverage, هذه quantity of sugar is 75 gram in 300 ml. بالعصير تفاح. Okay? So he will drink this glucose. First, they will collect his blood sugar. That is fasting blood sugar. Okay? Then he will drink the glucose tolerance. After 30 minutes, بيسحب منه الدم and they will estimate the quantity of glucose. بعد 60 دقيقة, they will take the blood sugar and estimate the blood sugar. After 90 minutes, they will take blood sugar and see this quantity of glucose. After 120 minutes, they will take. So how many blood collections? 4 or 5 times, including fasting. Okay. This 5 times will tell you how glucose he took have been metabolized. Because بعد 30 دقيقة هيرتفع الجلوكوز. After 60 minutes it will reach peak. Okay. طيب. After 90 minutes it will be high also. After 120 minutes هينزل تاني blood glucose. أيوه. Fasting blood sugar. بعد ما يشرب كل 30 دقيقة you will collect his blood sugar.
أول شيء
أيوة, fasting blood sugar before drinking. After that you will let him drink this, and then كل نص ساعة تسحب منه الدم. You will follow what? هتشوف that فيها absorption of blood sugar, هيرتفع البلاد sugar, will stimulate the pancreas to produce insulin, هينزل تاني. Okay, so this is what we call oral glucose tolerance test or glucose curve. Curve. That means you are following how this glucose is metabolized. If it's normal, fasting and 120 blood sugar will be safe. If patient abnormal, سواء كان نقصا insulin or problem in the receptor, what will happen? Glucose هيرتفع, ما هينزل تاني. Okay? ما هينزل تاني. طيب. In some patients, particularly in some children, when you give this thing, glucose, you will find that in fasting 120, after 30 minutes 120, after 60 minutes 140, after 90 minutes 110, after 120 minutes 120. So this patient have what? A linear. ما الجلوكوز حقها ما ارتفع وما نزل. وش السبب؟
instant
ايوه
homeostasis. homeostasis.
ما حصل امتصاص.
ما حصل امتصاص. Good. There was no absorption. So this patient have what? Malabsorption. Another disease. So this test we can also diagnose when there is malabsorption. لا malabsorption ما في absorption ما هيرتفع باللينير.
as fasting.
like fasting أيوة. ليش؟ لأنه ما في absorption. طيب this is oral glucose tolerance. طيب برضو أنت في العيادة جالك البيشنت with fasting blood sugar 200. That patient have got what?
hyperglycemia.
hyperglycemia. So he is diabetes. أول مرة جالك patient. طيب you wanted to know هل patient had high blood sugar لمدة كم؟ كان مريض قبل شهر ولا قبل شهرين ولا 6 شهور ولا كلها have got this high blood sugar. What you are going to do, you will test another test, you will send him to do another test, which is called glycosylated hemoglobin. H, glycosylated hemoglobin. Hemoglobin A1C. Hemoglobin A1C means glycosylated hemoglobin. ايوه glycosylated hemoglobin. ايش معنى glycosylated hemoglobin؟ Hemoglobin of this patient will be attached glucose permanent. Will be attached glucose permanent. طيب glucose hemoglobin is found where?
In the blood, the RBCs.
In the RBC. والعمر الRBC كم يا دكتور؟ 120 يوم. عمر الRBC 120 يوم. طيب so any patient who have high glycosylated hemoglobin, that means this patient he was sick for the last 3 months. Okay. So this is what test هذه it will tell you sorry chronology. That means duration of the marathon. If they have got high glycosylated hemoglobin, that means he was diabetic for the last 3 months. For the last 3 months. So you have to get an immediate action. Why immediate action? Then after 3 months of high blood sugar, he can have complication. Actual complication? أعراض مضاعفات. Complication means
Development.
complication means more
Disease.
مشاكل كثيرة. Okay, more problem. What will be the complication of the diabetes? It can be 3. The most important ones are 3. اللي هو إيش؟ retinopathy. retina إيش هو؟ شبكية. So he will have retinopathy. شبكة بتضيع. جواله ما هو شغال. That means نظره ما هو شغال. حيكون إيش؟ واحد شباب كان قبل 6 شهور he was normal. بعد 6 شهور تلقاه عنده عصاية. He cannot see. Why? Because he's blind. Due to what? Complication of the diabetes. How this comes? شبكة هذه very teeny, very small capillaries. اللي هو arterial capillaries. Right? In such patients, their شرايين حيكون fragile. That means it can easily be broken down. So what will happen? This retina first it will break down. يبدأ إيش؟ leakage. leakage إيش؟ تسرب الدم في in the inside the eye. Inside the eye there is a water called vitreous hammer. أخذتم الanatomy of the eye. ولا بس طيب very clear water inside the eye. هذه مليانة البوبل مليان المويه اللي هو vitreous hammer. So what will happen when drops of blood comes to this water? It will be colored. It will be what? Colored. So whenever there is a color, what will happen?
The light can't come in.
The light will not pass into this eye, or it will be reflected. Refraction.
تسحب منك عينين. هذا الجاري حق الهيموجلوبين. هذا إذا جاك مريض شو اسمه يعني إنه السكر حقه دائما عالي في حالة الفاصل.
طيب خليكم معايا. This is a water. It's clear water. طيب whenever an object passes from air to the water, what will happen? It will be. It looks like there is deviation. انكسار. This انكسار نسميها ايش؟ refrax. Refrax index. Refrax index. So what will happen? normal reflex index of our eyes is normal. 6 في 6 9 في 9 10 في 10. طيب whenever drop of blood comes here and this water is colored, what will happen? The reflex index هيزيد. reflex index هيزيد. that means ايش؟ الانكسار هيزيد. so one cannot see well. هيكون ايش؟ blurry vision مشوش. he cannot see well. he will have what? A blurry vision. This blurry vision can be corrected what? The glass. Okay. According to what? The reflex index. بيقيس بيقول نظرك شوية ضعيف. You need to be corrected. 0.25, 0.5, 0.75, 1.2. Okay. According to the refraction. So what happens? First he will have a نظارة 0.75. شهر شهرين لسه high blood sugar. More retin is broken down. More color of the vitreous. نظارة هذه والله مع النظارة هذه ما بيشوف كمان. يروح الدكتور ثاني بيكشف مرة ثانية بيقول لا نظرك لسه ضعيف وزيادة. not 0.75 0.1. okay. هذه هو the causes of the diabetes. right? So it will cause what? The retinopathy. أول شيء نظارات grades until it reaches what? Blindness. Until it reaches blindness. So it is called retinopathy. عشان ما يحصل البيشنت هذه لازم to be controlled what? This diabetes, this blood glucose. طيب or it can be nephropathy. Nephro means what? Renal failure. ليش؟ لأن high blood sugar will affect what? The osmolality. طيب in the nephron there will be filtration limit. This glass again volume حقها كم؟ 250. لو كبيتها 300 ايش اللي بيحصل؟ Okay, to lower flow. The same thing our body. Blood sugar up to 180 we can absorb. The kidney can absorb. If blood sugar reach أكثر من 180 200 what will happen? The 20 milligram glucose هينزل هيرتفع. Okay, so we call renal threshold. Threshold. ايش معنى threshold؟ renal threshold. That means the capacity of kidney to reabsorb the glucose. أكثر من 180 هيحصل ايش؟ هيندفع. So patient will have what? Glycosuria. Glycosuria. Urine present in glucose. Okay. Urine present in glucose. Type with the high blood sugar. Kidney overworks. And the front هو اللي بيعمل الوظيفة هذه كلها بيصنع اليورين. So he will be damaged. Nephropathy means what? Pathology means what?
Infection.
Virus. Okay. Disease of the nephron. Nephron هيتمرد and it will be destroyed. كل النفرون. Until patient needs what? Dialysis. Dialysis معناتها ايش؟ يعني هيحصل ايش؟ After all nephrons are dying, renal failure. فشل الكلى. Patient will need what? بدلها. اللي هو ايش؟ إما جهاز dialysis. He will go every 2-3 days to the hospital. They will filtrate the urine or
renal transplant.
Renal transplant. Good. طيب الثالث هيكون ايش؟ نيوروباثي. نيورو ايش معناته؟
نيورون.
عصب. Okay. Particularly the peripheral nerve. The peripheral nerve damage هيحصل in this patient. So that he will do what? He can have less sensation in the legs. He will feel less. He will stand up on fire. He will not feel until he's damaged. Okay. هيحصل الجرحى. He will not feel. but he will see later what blood coming on his leg. يعني ايش الدم هذه؟ فين الدم؟ لأن what he will not feel pain. ليش؟ لأن حصل ايش؟ neuropathy. In this neuropathy also causes shrine can be damaged. Okay, it can be closed. So whenever the artery is closed, what will happen? Arteriosclerosis and obstruction. In the heart we said myocardial infarction. Amma in the legs what will happen? Gangrene. ايش هو gangrene? Death of the
tissue.
Death of the tissue in which that artery was eroded. So what will be the treatment of the gangrene? Cutting. So mainly they will cut with under knee amputation. Under knee amputation. That's the best treatment. If you have gangrene on the 1-2 and you cut one finger, هيحصل ايش؟ بعد شهرين هيحصل finger ثاني، بعد 3 شهور. So every time you have to cut. Once you find the presence of gangrene, it's advised to have what? Under knee, rubber. Under knee amputation. Amputation means cutting. Okay. طيب هذه كلها بيحصل ايش؟ أعراض هذه كلها بيحصل سببا ايش؟
hyperglycemia.
So patient before he's having all these complications, you have to advise him to do what? Consistent monitoring of the blood sugar. Consistent monitoring of the blood sugar. Okay, starting from next week, we will do blood glucose analysis. Okay, inshallah, we will have next week.
System or hypoglycemia.
Yes.
Hypoglycemia.
Hypoglycemia. That's another problem. Mainly, patients who have diabetes, particularly those who get insulin, what will happen? If they get overdose, quantity of insulin he gets is high, هيحصل ايش؟ كل الانسولين will be absorbed in the cells. هيحصل hypoglycemia. So there are difficulties also in hypoglycemia and in hyperglycemia both. We will talk this later. Yes.
Doctor, after insulin reacts with the receptor, what will happen?
Insulin reacts with the receptor. It will stimulate glucose transporter. It's موجود in the receptor. So it will open the gate. كل الجلوكوز هيخش داخل الخلايا.
What's the more dangerous? Hypo or hyper?
Hypo is rapid dangerous because patients who have hypoglycemia he can go into coma and death. That's why in the emergency case, whenever patient unconscious comes, سواء كان is diabetic or hypoglycemia or hyperglycemia, you will give him an insulin therapy. If he's hypoglycemia, he can wake up. If hyperglycemia after test, at that time you will give him an insulin. Okay. So emergency, you have to give him glucose.
Doctor, in the type 2, the first time tell him to not eat sugar. Then if not work, tell him to do exercise.
أيوة.
Then
diet.
Oral hypoglycemia.
أيوة. Diet, exercise, oral hypoglycemia.
Oral